So this is impression compound. It comes in the shape of cakes. We use this material to make primary impressions for edentulous patients. This is another impression compound cake from a different manufacturer, and you can see the difference in color. So we're going to use one cake of impression compound. This is a piece of gauze. We unfold it like this. Okay, and then we bring the impression compound cake. We break it into pieces. So we need 1 cake and half for the upper jaw. And then we wrap the gauze around the pieces of impression compound and we soak it in a hot water bath. Here is a thermometer. It measures the temperature of the water bath. It must be between 55 to 60 degrees Celsius. We leave it for a few seconds in the water bath until it's soft. Then we remove the gauze from the rubber ball from the water bath. You can see now that the impression compound is soft. You can lubricate your hands with some Vaseline so the material doesn't stick to the gloves. If it's very hot, it will be sticky. So here we start to knead the material. Start kneading the material to distribute the heat evenly, and then we distribute the material on the tray, or we load the tray. We make the material like a ball and we place it in the center of the tray, and then we shape the material around the tray. We make a groove which represents the groove for the alveolar ridge. We leave the area of the hard palate a little bit elevated, and we make sure that we cover all the borders of the tray with the impression compound. Make sure that the material is soft enough when you load the tray, so it doesn't have wrinkles on it. Then we put it back in the water bath to make sure that the material is soft enough before we make the impression. Again, we place it in the piece of gauze so it doesn't stick to the sides of the rubber ball. And we start making the impression. We place the tray first posteriorly and then rotate it anteriorly with some pressure, then even pressure both sides, and we make sure that the tray is centered, making sure that the groove on the handle is coincident with the midline of the phantom head. Make sure that the material is filling the sulcus. Then wait a few minutes until the material is hard and we remove the impression. It should look like this. Uniform borders, rounded notches in the place of freni, no wrinkles in the fitting surface, no defects in the palate. All the anatomy we need are obvious on the impression. Maxillary tuberosities, rugae, incisive papilla, hamular notches, frenal notches. Okay, now we're gonna do the lower impression. We soften the impression compound. Some Vaseline on your hands. You might need to place some Vaseline on the jaw. We need the material to make sure that heat is distributed evenly inside the material. Here we shape the material like a sausage, and then we place it, or we load the tray. We load the tray with the impression compound. Again, we make sure that the impression material is covering the borders. We make sure that we remove the gross excess. Make a groove in the center of the tray to represent the alveolar ridge. Here we remove the excess. And we put it back in the water bath for a few seconds to make sure that it's soft enough before we make the impression. Now for the lower impression, we seat the tray in an angle and then vertical pressure on the tray to seat it. You can see that the excess is coming from all around the tray borders. Make sure that the excess is filling the sulcus to record the depth of the sulcus, and keep supporting the tray all the time. After the material sets, it's hard, you can remove the tray and we can see the lower impression like this. Uniform thickness of the borders, continuity of the borders, the retromolar pad areas are clear on the impression. The alveolar ridge, lingual frenum, labial sulcus, lingual sulcus,